Mass drug administration, or MDA, for neglected tropical diseases, a strategy that began small but now saves and improves lives on a massive scale. Imagine a world where communities come together, armed with a common purpose to conquer diseases that have plagued humanity for centuries. Where the simple act of taking medicine can interrupt the cycle of transmission for debilitating conditions, bringing hope to millions and transforming lives forever. Today we explore the remarkable evolution of mass drug administration, or MDA, for neglected tropical diseases, a strategy that began small but now saves and improves lives on a massive scale. Join us on this journey as we uncover the story behind this life-changing initiative. Our story begins in the heart of the early 20th century when a new idea emerged, an idea that would revolutionize the way we approach public health interventions. It all started with a common enemy, a tiny worm called hookworm, which had been silently sapping the strength and well-being of people in the southern United States for decades. Life was tough for those living in poverty in the rural South. And to make matters worse, a tiny worm had made itself at home inside them, feeding off their blood and leaving them weak and weary. This was no ordinary parasite. Hookworms could wreak havoc on a person's life, causing anemia, stunted growth, and a general feeling of being unwell. For generations, people had tried to fight back, but the problem seemed too big, too deeply rooted in the soil and the poverty it took to eradicate. Enter the Rockefeller Sanitary Commission, a group of dedicated individuals who refused to give up in the fight against hookworm. In 1910, they embarked on a mission to eradicate hookworm in the southern states, a mission that would become the blueprint for future MDA programs. They knew that to succeed, they needed to reach everyone in affected communities. So they developed a plan so bold that it had never been tried on this scale before. This was an idea whose time had come: mass treatment of entire communities with a powerful antiparasitic drug called thymol-saliginol. It was a risky move, but one that promised extraordinary results if it worked. They reached out to doctors, pharmacists, and community leaders, rallying them to support this ambitious goal. The response was overwhelming. Thousands of volunteers joined the cause, distributing medicine to families across the South. It was a Herculean effort, a battle fought door to door, farm to farm. But slowly, surely, the tide began to turn. As more and more people took the medication, the grip of hookworm started to weaken. Cases dropped dramatically, communities were freed from the burden of the disease, and hope bloomed for a brighter, healthier future. This groundbreaking campaign achieved what many thought impossible. It eradicated hookworm in the targeted areas, proving that mass treatment of a disease could be not only effective but also efficient. This victory sent shockwaves throughout the medical and public health communities. It showed that with the right strategy, even the most entrenched diseases could be defeated. The Rockefeller Sanitary Commission had done the seemingly impossible, but their triumph over hookworm would serve as the foundation for something much bigger, a legacy that would echo around the world and transform global health forever. Fast forward to the latter half of the 20th century, and the world was grappling with a new set of challenges. Among the most devastating were a group of neglected tropical diseases, NTDs, which afflicted hundreds of millions of people, mostly in resource-limited settings. These diseases, including river blindness, lymphatic filariasis, trachoma, schistosomiasis, and soil-transmitted helminthiasis, were not just a source of immense human suffering, but also a barrier to economic development. Despite their impact, these diseases often flew under the radar, neglected and overlooked. The lack of effective tools and resources to combat them left many wondering if there was even a way to make a dent in the problem. However, the spirit of innovation and collaboration that had driven the eradication of smallpox was not ready to rest, and the stage was set for a new chapter in the fight against these neglected diseases. In 1987, a major breakthrough occurred. Merck, a pharmaceutical giant, stepped forward with an offer that would change everything. They donated 1 million tablets of ivermectin, a safe and effective drug for treating river blindness, to be distributed free of charge for the control of onchocerciasis. This generous donation marked a turning point, setting in motion the wheels of a strategy that had been dormant for decades. With this gift, the groundwork was laid for the first large-scale, long-term pharmaceutical donation program. Merck's contribution didn't just provide a lifeline to those suffering from onchocerciasis, It became the catalyst for a wave of similar commitments from pharmaceutical companies for other NTDs. This was a testament to the vision of those who had dared to dream of a world free from these neglected diseases. The impact of Merck's donation rippled far beyond the initial recipients. It inspired other pharmaceutical giants to follow suit, donating essential drugs to tackle various NTDs. Soon, a growing number of companies were on board, each playing a part in advancing the goal of a healthier, disease-free world. The momentum was building. The stage was set for an unprecedented global collaboration. The World Health Organization, WHO, recognizing the urgency and importance of addressing these neglected diseases, established a dedicated department in 1993, marking a significant step in raising awareness and coordinating action on a global scale. The establishment of the World Health Organization's NTD department in 1993 was a pivotal moment in the fight against neglected tropical diseases. This marked the first time that these often overlooked conditions were given a prominent place on the global health stage. The department served as a hub, bringing together experts, governments, non-governmental organizations, and pharmaceutical partners to develop and implement strategies that could make a real difference. One of the most significant contributions of the NTD department was the introduction of the term neglected tropical diseases itself. This reframing of the conversation helped to shift the perception of these diseases from being a collection of disparate and minor ailments to a group of conditions that deserve priority attention and resources. As the new millennium dawned, the landscape of global health was transformed. The groundwork laid in the previous decades had led to an unprecedented opportunity to tackle neglected tropical diseases head-on. By the early 21st century, several key factors converged to accelerate the adoption of MDA as the primary strategy for NTD control. First and foremost, the donation of albendazole by pharmaceutical company GlaxoSmithKline in 2001 provided a crucial tool for combating soil-transmitted helminthiasis and other NTDs. This generous contribution expanded the arsenal of available drugs and bolstered the campaign's ability to treat a wider range of conditions. But it wasn't just about having the right drugs. The late 20th and early 21st century witnessed a surge in research that provided solid evidence of the efficacy and safety of mass drug administration. Studies demonstrated that MDA could not only alleviate symptoms and improve the quality of life for millions, but could also break the transmission cycle of these diseases, potentially leading to their elimination. The growing body of evidence combined with the availability of essential drugs fueled a call to action. National and regional programs began to incorporate MDA as a central component of their strategies, recognizing its potential to deliver substantial health and social benefits. The convergence of these factors marked a turning point in the fight against neglected tropical diseases. With the right drugs in hand and the evidence firmly supporting their use, the global health community was ready to embrace mass drug administration as the key to unlocking a healthier future for millions. In recent years, programs have evolved to become even more comprehensive and efficient through a process known as integrated mass drug administration. This innovative approach involves delivering multiple drugs in a single campaign, eliminating the need for separate rounds of treatment and maximizing the use of shared resources. One striking example is the delivery of 3 drugs, albendazole, ivermectin, and praziquantel, to tackle a trio of prevalent NTDs, soil-transmitted helminthiasis, onchocerciasis, and schistosomiasis simultaneously. This integration not only streamlines the treatment process, but also amplifies the impact, providing relief for millions who suffer from more than one condition. Another notable advancement is the focus on reaching specific high-risk groups, such as school-age children with a high burden of disease. Tailored approaches like these ensure that those who need treatment the most get it, maximizing the impact of each campaign. Despite the incredible success of MDA programs, they haven't been without their challenges. One significant hurdle has been addressing treatment hesitancy or refusal due to misinformation or cultural beliefs. To overcome this, programs have implemented strategies like community engagement, education campaigns, and the training of local health workers to build trust and provide accurate information. Additionally, efforts are underway to improve access for populations in hard-to-reach areas and address gender-based inequities in treatment coverage. Innovative solutions like the use of mobile phones and digital platforms are helping to bridge the gap, ensuring that no one is left behind. Looking ahead, the future of MDA for NTDs is bright. As science advances and our understanding of neglected tropical diseases deepens, new drugs and tools are on the horizon. These will further strengthen the impact of MDA, bringing us closer to the goal of eradicating these diseases once and for all. One promising development is the pipeline of new drugs and vaccines for various NTDs. These innovations hold the potential to not only expand the range of treatable conditions, but also to enhance the effectiveness and sustainability of MDA programs. Additionally, ongoing research into novel drug delivery systems, such as slow-release formulations, could reduce the frequency of drug administration, making treatment more convenient and improving adherence. The use of technology is also transforming the way MDA programs are implemented. From GPS-enabled mapping to track disease prevalence to mobile phone-based reminders for patients, technology is playing an increasingly important role in optimizing treatment coverage and reducing costs. As we look to the future of MDA, it's clear that this strategy has come a long way from its humble beginnings. What started as a small-scale effort to combat hookworm has evolved into a global phenomenon, transforming lives and saving countless more. Today, MDAs play a vital role in the global health landscape, aligning with the Sustainable Development Goals, particularly those focused on health equity, poverty reduction, and universal health coverage. Its impact is undeniable. Since its inception, MDA has been instrumental in interrupting the transmission cycles of numerous NTDs. Through mass treatment, significant reductions has been seen in the prevalence of diseases like onchocerciasis, lymphatic filariasis, and trachoma, bringing closer to national and regional elimination targets. Moreover, the benefits of MDA extend beyond the immediate health gains. By reducing the burden of disease, MDA contributes to a healthier, more productive population. It decreases morbidity, hospital utilization, and the need for secondary infections, leading to an overall improvement in quality of life. Furthermore, MDA plays a crucial role in breaking the cycle of poverty by mitigating the disability and school absenteeism associated with NTDs. This is particularly significant in regions where these diseases are prevalent, as it supports educational attainment, workforce productivity, and broader economic development. As public health professionals continue to invest in research, innovation, and global partnerships, it is possible to unlock new possibilities for tackling neglected tropical diseases. The road ahead is filled with challenges, but also with immense opportunities to improve the lives of millions. Reflecting on the incredible journey of MDA, it is also important to celebrate the countless lives that have been transformed and saved through this remarkable initiative. The story of MDA is a testament to what can be achieved when communities, governments, researchers, and global health organizations unite with a common purpose. Together, we have the power to conquer the most daunting diseases and build a healthier, brighter future for all. Subscribe our channel for more videos.